Everyone, welcome back to part three of this video series on thoracic outlet syndrome. In this video, we're going to talk about why posture really matters for thoracic outlet syndrome. And it's not that I promote a perfect posture all the time, but specific to TOS, a compromised posture is going to narrow the space between the first rib and the collarbone, and that creates compression on the nerves, so the brachial plexus, and the blood vessels, the subclavian vein and the subclavian artery that run through that space. So we're going to cover why posture matters for TOS. We're going to talk about different workstation ergonomics, some postural tweaks that you could incorporate into your day-to-day, and then some postural cues that actually work. So some ways that you can incorporate into your body a different way to think about your posture. Again, this is part three of the video series. In part one, we covered what is thoracic outlet syndrome, what are the different types, and what are symptoms. And then in part two, we covered how is thoracic outlet syndrome diagnosed and what's the common treatment methods for each type of TOS. I'll put links in the video description for parts one and two, but let's get into part number three here on why posture matters for TOS. Let's talk about where your posture likely breaks down during the day. And as I said in the intro, it's not about having the perfect posture all the time, but it's becoming aware of the postures that you frequently put yourself in, and with the breakdowns within that, that really is the problem. And those common postural positions are going to be the shoulders rounding forward, the head getting pulled forward. So it's that head and neck position there, the combination of slouching through the middle back, shoulders rounding forward, and then head dropping forward. And as you can see, gravity sort of pulls us into that position. So we find ourselves there quite a bit. And I'm going to cover a few of those most common positions. Um, on the note of posture, we can have traumatic injury to an area, and then we can have micro traumas or small repetitive traumas. Postural evaluation is really about becoming aware of the micro traumas, the small things that you're doing, but you're doing it for hours a day that then becomes a bigger problem. So some of those different positions are if you're spending long hours on the computer, if you are driving with your shoulders hunched forward, if you are looking down at your phone quite a bit, so head falls down. And as you can see from the side, the head drops down here, that pulls the upper trap forward. Really, like that shoulder position here or here pulls the shoulder blade forward, tilts it that way, and creates compression in that thoracic outlet area. We're resilient. We can handle a certain amount of that position, but it's the chronic repetitive positioning there that becomes a problem. So we covered driving, we covered computer work, we covered time on your phone. Slouching in the bed or on the couch at night is another common problem that happens. So many of my patients with TOS, they they lay in bed or they slouch on the couch where their low back slouches down, and then that pulls this area forward here. And then the last one would be carrying heavy bags or a heavy bag on your shoulders, because that position of a heavy backpack will draw the shoulders forward, or if it's a heavy purse on one side, it pulls the thoracic outlet down into a compressed position. Think about it as it's not each one of those positions individually, but a lot of times when I talk to people, they are looking down on their phone while slouched on the bed, or they're slouched on the couch while watching television. They are doing work while in a slouched position. So it's often the culmination of several of these things that happen at the same time. And then lastly, and this goes more into mind-body interaction, but when we put ourselves in that slouched position, it's often the amount of stress that we're under while we're in that position. So it's okay that you're here, but if you're really intensely working and you're holding a lot of tension because you're trying to meet a deadline at work or you're under a lot of stress, it's the added stress on top of the position that really becomes a problem. But those are some of the most common postural traps or the areas of breakdown that I see throughout the day. Next, let's talk about workstation ergonomics that actually make a difference. And I'll tell you, as I'm preparing for these videos, I'm doing some of it sitting in a desk chair. I'm standing. I am thinking through these videos while I'm walking. And I'm also doing stuff like going into a half kneeling position where one knee's down on the ground, the other knee's up. So I'm opening up my hips, alternating positions there. And then even working with a computer down on the ground. So I'm lying on my stomach, propped up on my elbows, and opening up the space there. And as you'll see, it's not that any single position is bad, but it's the prolonged repetitive position and stress under that position that becomes the problem. So the overarching tip that I want to give here is the more that you can take movement breaks or changing up your posture through different movements is really going to be the best thing that you can do. Now that's not possible for everyone. So especially if you're in the office and you have a pretty fixed work setup, ideally you can get some sort of standing desk where you can go from sitting to standing and changing your position there. But let's assume that you are having to sit for periods of time. These are the four things that I want you to think about. First is going to be your elbow position. Second thing is going to be the monitor height. Third is going to be chair ergonomics, so ways that we can alter the chair position. And then lastly would be trying to use some armrests to help with different irritation of symptoms for TOS. First of all, elbow position. I want your elbows to ideally be hanging around 90 degrees, so a 90-degree bend from the elbow to the shoulder. And the reason that's important is if you find yourself throughout the day kind of working higher and higher up here, or you're mousing with one hand, that creates a lot of tension through the upper trap. It pulls the shoulder girdle up and uses these muscles, and that creates more tension or compression. So, elbow position, think a 90-degree bend at the elbow, relaxed shoulder position, and then work from there. Next is monitor height. You can probably see on this video that my monitor height is very close in line with eye level. If you're working on a laptop especially, and the monitor is way down here and you're having to look down all day, that's going to force your eye position to go down, and that's going to create a lot of extra strain through the neck and through the shoulder girdle. Your head weighs about 8 pounds. So 8 pounds, an 8 pound weight that you're holding in front of you or looking down for hours a day can be a lot of extra strain throughout the muscles of the neck and the shoulder. So we covered elbow position, monitor height. Third thing I want you to think about is your chair setup. So ideally, you're using the back of your chair. So you're sitting back with some back support. Your feet should be flat on the ground. And then next, think about having your hips slightly above where your knees are at. So you can just do this experiment right now. If you raise your knees up or if you put your feet on a stool, what that does is when your knees go higher than your hips, it pulls your low back into more of a flexed, rounded position. And the position of your low back dictates the position of the entire spine. So if my knees are higher, I slouch through my low back, you slouch through the shoulders more, and then it creates more tension through here. So you should be sitting upright with the hips slightly higher than the knees, which is going to put your spine in a better position for good posture overall throughout your spine, all the way up through the middle back and the neck. And then lastly, I would suggest I don't have armrest on this chair because this is actually my wife's working station. Um, but if you have armrests, I do recommend using those because oftentimes the shoulders will kind of get pulled down and forward throughout the day. And an armrest can give you a little bit of support here to offload the shoulder girdle area. So using armrests can be a beneficial adjustment, especially if you're noticing symptoms of thoracic outlet syndrome. Final piece on this is those four workstation tips will be beneficial, especially for calming down symptoms and just for changing up your posture. But the biggest thing is trying to take movement breaks every 20 minutes or every 45 minutes, whatever you can really tolerate, whatever your job sort of demands. But the more frequent movement breaks you can take just to get up, change your posture, help loosen up whatever muscles have been holding stress or holding tension, that's probably going to be the best thing that you can do. So the more ways that you can find different postures to work in, I think that's going to be like the most bang for your buck. Next, let's talk about some quick daily habit tweaks that you can incorporate into your day to day. And the reason that this is important is that posture is a prolonged, repetitive sort of micro trauma on the system. And the more that we can interrupt that pattern or that habit, that cycle that you're in, the more that we can adjust the symptoms that one's experiencing with TOS. So, some things that you can think about. One, if you're always carrying a bag on one shoulder, switch up the shoulder that you're carrying the weight on. So, evenly distribute where the weight is going. If you're using a backpack or if you're still in school, if the backpack sits really low on your back, that's going to add a lot more compressive force down on the thoracic outlet. So, tighten the straps more so where it's snug across your back and your shoulders. That's a good way to distribute the weight. Second thing would be if you have the ability to use a headset or headphones instead of kind of cradling a phone here. Not that many people do that position anymore, but the ability to use a headset or headphones for different meetings or phone calls can really change or alter the position of your neck and that thoracic outlet area. Third, a sleeping tip that I would provide is find a pillow that works for you. Oftentimes, if we're here throughout the day for a long time, people like to have a lot of pillows that then sort of cushion or provide support to that area. But that's again creating this forward head posture. So I typically recommend trying to use one pillow. And then if you're a side sleeper, that one pillow should fill the space from here to here. If your one pillow is pushing you this way, that's creating a tensile or a stretching force across the neck. If the pillow is too thin and your head kind of drops there, then that's creating more of a compressive force through that thoracic outlet region. So find a pillow that supports you in that space and doesn't push you too far forward so your head can rest in a nice neutral position. Uh, if you are someone who tends to lean on their elbow, see if you can balance that out by alternating which elbow you're leaning on. I know I used to, when I was driving, I used to always sort of sit on the middle console. And that position not only changes down through the lumbar spine, but it was altering the forces that went through the thoracic outlet. So if you always lean on one shoulder, try to balance it out and lean on the opposite one, or go back to some of those kind of common postural cues of good posture, good chair ergonomics that I talked about in the prior section. And then lastly, what I'm going to get into in the follow-up videos is different ways to open up the pec muscles and activate the middle back. Because this video has talked a lot about the postural requirements that we're trying to change. Really, what's equally important is opening up the front, becoming strong through the middle back, because those are the muscles that support the thoracic outlet region. So these are some beneficial ways, some small habit tweaks that you can use throughout your day to offload or mitigate some of the symptoms of TOS. Lastly, let's talk about some postural cues that actually work. What you're not going to hear me say is to sit up straight, because sitting up straight, that often has a military sort of connotation, and that creates more stiffness or more tightness in people. So just sitting up straight doesn't seem to work for people. And the goal is not about one stiff, rigid posture. It's about being dynamic or being relaxed in where your good posture is at. So, some postural cues that I think actually work for people. The most important one, or the first one that I give everybody, is to imagine that if there was a string or a balloon gently lifting your middle back up, that position here. So, imagine someone, if I'm slouched like this and someone pulls me up right here, that lifting cue through the chest with a light core engagement is a great way to put the middle back, the neck, and the thoracic outlet in a good position. Oftentimes, people will say, pull your shoulder blades back, but that tends to create more stiffness or more tightness, and it's not a sustainable posture. What's much more sustainable, and as you'll see, the position of the shoulders naturally changes. When you lift through your middle back, the shoulders naturally fall back into the position that they're supposed to be. So it's not shoulders back, it's a gentle lifting of the chest up. That's the first cue I would give. Second, if you're someone who tends to hold a lot of tension in the upper traps here, I want you to think again, it's a soft cue of pulling the shoulder blades down and back as that chest lifts up. So the shoulder blades go down and back, not forcing them down, but it takes it from this position where these muscles are on to using the lower shoulder blade position, which pulls the shoulder down and away from that position. Third, the position of the head and the neck. Now, our head is meant to be mobile, so I don't want you to think about uh, don't pull the chin back like this. That creates a lot of tension on the back side of the neck, and it takes away the natural curvature that our neck needs. So don't think about it as chin back, but instead imagine if someone had a string on the top of your head and it's lifting you up. So you're getting length through the back of your neck, but by means of lifting all the way from the pelvis up through the top of your head. So if there was a string here and someone like a puppet was lifting you tall, you should get length through your neck, not like this, but rather lifting the entire spine. And then lastly, think about trying to stack your ribs over your pelvis. Now, it shouldn't be, sometimes people tend to flare like that. And then here, my ribs are going forward from my pelvis. So with a core engaged position, staying stacked from here down to the pelvis, that's another good cue that you can think about. As you'll notice with all of these, there's not a lot of force, there's not a ton of engagement, and it really comes from the position of the middle back, helping guide where the shoulders are going. So I always say, draw the core in lightly. So pull the core muscles, belly button in towards your spine lightly, and then that will help stack the rest of the rib cage. Those are some of my postural cues that I give to clients every day that helps adjust and change you from that forward rounded position where the head's forward to putting you in a more tall, upright posture, opening up the space in the thoracic outlet. To recap, if you're dealing with thoracic outlet syndrome, these postural and ergonomic tips that I provided are not optional. These are essential things that are going to help reduce compression, they're going to help calm down symptoms, and they're going to help put you on your way to healing. So I hope you found them helpful. In the next series of videos, I'm going to talk about different ways, TOS specific exercises for both mobility and strengthening the middle back, giving you neural glides for the nervous system, and other mobility work to get your back stronger and more mobile. So I hope you found these videos helpful. If you are finding them beneficial, please like, comment, subscribe so we can continue to spread the message. Thanks.